My name is Yvonne Okoruwa. I started with the Care Center in August. I have a bachelor's degree in education and English studies. I also have a master's degree in psychology. But after school, I did some volunteering with communities, especially with non-profit social work. And that was where the interest kicked in for me to go into social work. I took an interest in that area and decided to go for a master's degree in social work. And then I did my research on schools offering top social work programs, having top social work programs, and UGA was one of them. As interns, we come in on Wednesdays to Fridays, and most of our duties involve screening of patients, trying to get to know them better, trying to schedule appointments for them to see the neuropsychologist or the geriatrician, and then also to see the support care director. We also do patient rounds. So we have our patient rounds meeting on Wednesdays, and we sit down there just to learn more about the diagnosis of patients. And then we also have the support group meetings, which holds twice every month on Thursdays. And it's more like care support for the caregivers and also the dementia patients. We have the music therapy session. It's been very beneficial to the dementia patients because it's like an avenue for socialization for them, and they get to distress. They've gone through some form of stress, and then it's like an avenue for them to just get exposure, learn, and get the experiences of other patients. I have always had an interest in working with the elderly population, especially with dementia and Alzheimer's patients. I just have that passion of trying to offer care and services to them in the best possible ways I can. And it's an interest area which I really wanted to know more about, and I felt interning in a clinic, in this kind of clinic, would be able to give me or equip me with the necessary skills and all that I need to function effectively in a clinic. I did my research on clinics and hospital settings that offer care to dementia and Alzheimer's patients. The Care Center was one of those on the top list, and I got more interested in them, and then I did my research more on them, and I saw that it would be a place that would give me the skills that I need, and it would expose me to the experiences needed. Getting into school, I knew it was social work, but I wasn't certain on the exact area to focus on. But so far, with the classes I have had, I think I'm now sure that it's clinical social work and then working with the older population. So, long-term plan to work in the clinical setting as a clinical social worker. Getting to know patients more, like speaking with them, it's teaching me a lot, especially on active listening, patience, and empathy, and trying to understand and validate the feelings of the patients. So I think that's a learning phase for me. Okay, I would say working with Care Center has been a learning phase, like I said, and I like the people here. Like, everyone is being they've been receptive. It's easy to communicate with them. They've been very friendly, and I get to learn a lot from the medical team, from the neuropsychologist, from the director of social support services, who is my supervisor, Dr. Sarah. And I think it's a good place to be.